Geriatrics, Chapter 31, Health Policy and Advocacy. So this is an area that I feel very passionate about. So I hope that you guys will take the time to listen and understand a little bit more about legislation. I know sometimes it gets a little bit dry and boring, but there's some real important parts here to make sure that you understand. So the way your book describes it, they talk about legislation that is put forth. That's going to be put forth by the legislators. There is regulation that has to happen after legislation is put in place. So kind of like we talked about with Medicare. So Medicare legislation is put forth, but then there has to be a regulating body that puts forth specifics of how it's going to be administered and how that's going to work. There's professional standards that need to be looked at and addressed. When it comes to PTs, that would be more of our Practice Act, and then there could be some specific public health policies, and each area might be a little bit different. So an area that might be a little bit more rural might be the public health policy there might be access to health care. So are there enough providers in that region to care for the patients that really do need it? So when it comes to the specific policy, that legislation that's put forth helps to make those decisions for determining present, maybe and future objectives pertaining to our healthcare system. Regulation, specifically in Kansas, is done by the Board of Healing Arts, and each state has their own jurisdiction that helps cover those specific regulations. And then again, that Practice Act is the professional standards for which we have to abide by. And then there's also rules and regulations that go forth underneath any legislation that was enacted. So we've got from the federal side and then from the state side, there's different laws that govern both. And you have to make sure that you understand both of those. So from a federal standpoint, we've got, like, if we're talking about insurance, we've got our Medicare, but then from state regulations, we might have other stipulations that come into play. So one of the things that we pushed for in Kansas was to get direct access legislation, and you have to go by whatever is the most restrictive and covers the most patients. So we got legislation put forth for direct access for our patients, but Medicare guidelines still state that there has to be a plan of care in place. So that still trumps what we would look at from a state regulation board. There's a couple different domains of health policy. We have to look at the costs of things and the financing of things. So whenever we're talking to legislators about specific legislation, they're almost always going to ask you what the cost of something is. So our National Association does a really good job of looking at cost analysis to understand what the cost factor is going to be, whether it's going to cost money for this plan or if it's going to save money. Legislators really want to look at things that are going to be cost savings, or at least what we call cost neutral, so it's not going to cost any more to provide it than what it already costs right now. So if we can provide some sort of a service that helps residents and make it not cost much or not cost much, the cost benefit is there, then legislators are going to be more on board with what we're putting forth to them. Access and availability, that's another big one. Especially when we talk about rural areas, access to healthcare is huge. How easy is it for a patient to access care in the rural parts of our state? It's not very easy. Not every city has a doctor. And then maybe even if some smaller towns do have a doctor, if you need cardiac care, there might not be a hospital very close to you. So that's the big thing that legislators want to take care of, is how do we take care of our all the residents across the country. And then when it comes to any sort of legislation, they want to have good quality and good outcomes. So again, they're looking at that from that standpoint as well. So just because something sounds good, we have to make sure that we can prove that it's actually going to be beneficial to our patients. So you guys can go ahead and pause this. I want to make sure that you take a chance to look at this Schoolhouse Rock bill. It's just kind of a cute way to talk about how a bill goes into law. There's things that sometimes we forget that we might have learned about in grade school about how a bill becomes a law, but I want you guys to look at that and make sure that you understand the process there. It's pretty simplified, a little cute cartoon, but it helps to show how that actually works. So advocacy and what it really does mean. So when it comes down to it, we have to understand what the issues are. So from the top of the circle at the 12 o'clock spot, we have the identify the problem here, and we need to look and see, what are the issues. So if it comes to maybe rural Kansas, there's not good access to healthcare for patients in that area, so that might be the problem. You have to conduct research and gather data. So how many people are in that area? So if we have a county that only has 10 physicians and 1 hospital in that area, how many lives are they covering in that area? You need to make sure that you have all of your numbers in order to make your case. What are the principles, the priorities? What are the outcomes you want to get? Is it that we want to have, easily accessible hospital within 60 miles of every patient? Something along those lines. We have to know what the outcomes actually are. We have to develop and implement an advocacy plan. So once we come up with whatever that plan is, you have to put together an advocacy plan to help you establish that. So how are you sharing that with your legislators? They don't need to know all the nitty-gritty, but they need to know the specific data that helps them make up their mind. Same thing I would imagine with any of you guys as you're starting to understand specific advocacy points. What does it really mean? What is this plan, and why does it make sense for you or for them, for your patients? And how do you then voice that to your legislators? Once we have that, we want to build support and manage the opposition. So we've had issues, especially in Kansas, when we tried to get direct access. We had to make sure that we had everybody on board. Legislators really like it when you go out to other groups that might have problems with this and work through any potential pitfalls or issues. Legislators want things to be very easy. They don't want to have to go into a big battle and a big fight most of the time. So making sure that you have all the stakeholders sitting at the table discussing these problems and these issues and knowing what your opposition might be. So when it came to direct access, there were quite a few different groups that were opposed to us moving forth. The physicians were very much opposed to this initially. Chiropractors were very much opposed to us getting direct access, and there were other groups that were in the wings that were against us doing this. So we had to make sure that we were building support. So how do we talk about the benefit of PT without stepping on other people's feet? So how does this benefit the physicians? Can we take some of the burden and the caseload off of them? Physicians are so busy these days with seeing patients. They might have to see, primary care doctor might see 30, 40, or 50 patients a day. Well, what if it's a musculoskeletal issue that we could see for them, especially now that physicians are being mandated to not prescribe as many opioids? If we can take that pressure off and say, hey, if it's a musculoskeletal issue, when the patients call in, just refer them to physical therapy immediately. Then PTs can kind of triage the patient and determine whether or not physicians need to get in the loop. So making sure that we're building that full case for everybody involved. Then we need to assess and evaluate where we are. So if we know that there's going to be a big opposition, how do we play to our strengths and help everybody see the benefit of what it is that we're doing? Or is it still worth it for us to push forward and present this to our legislators? So there's a whole lot of things that go into looking at any specific bill that we want to push forth. So looking at specifically how the changes are made and who does the work on the grassroots side and on the ground floor to get anything to our legislators. And obviously from the federal side we have the APTA, and those are the dues that we pay every year. And I do really want to stress the importance of being a member of the APTA. I know sometimes they get a bad rap for not covering everybody, but it takes strength in numbers. The physicians have a much bigger lobbying power than we do. They're going to get more things accomplished and more things done. They have a much, what I'd call, stronger and louder voice if they have more people there. More people equals more money. As much as we don't want to talk about the dollars when it comes to helping people and making them better, when it comes to the legislation, this is how money talks. So it's really important that we pay into our association. So from the federal side, we have the federal affairs liaisons, and each state has a liaison that then disseminates that information to our state. So we have definitely lobbying efforts from a federal level, and there's always going to be federal issues going on. And then from there, we want to make sure that we're spreading the message. So again, there's always different issues going on. You have to make sure that you find what things speak to you, or how can you be a voice in our communities when it comes to these different issues that are out there. And then from the state side, we have, on the Kansas side, obviously, the Kansas PT Association. So we deal, again, with just state affairs. not the national stuff. We're only going to deal with state affairs when it comes to the Kansas PT Association. So we've discussed before the dry needling issues that came about in 2016 and how we got legislation that clarified allowing for PTs to provide dry needling in our state, which was wonderful. And in 2013, again, we also got somewhat restricted direct access. So we're able to do quite a bit, but there are some stipulations there as far as what is allowed, how soon you have to get a physician signature or a physician on board, and whether or not you do actually have to get a physician on board. So making sure you understand the nuances when it comes to that. Every state is going to be different. So although most states do have some form of direct access, it's different in every single state, and it's important to know that when you're moving, or if you're going to move from state to state. So the lobbying efforts here are with our local lobbyists, and we do have some great lobbyists here in Kansas that we work with, and they work specifically with the state legislative chair on that. And then we also need help from volunteers. So patients, PTs, PTAs, anybody that wants to help out is asked to volunteer. Any of the people that do any of the work that we just mentioned, so from the Federal Affairs Liaison to our state legislative chair, those are all done by volunteer positions. So nobody on that stage gets paid to do that. Now we do have people at the national level that do get paid to fight on our behalf every single day. And that's part of where our dues go. So when it comes to the Federal Affairs Liaison, this is something that I did for about 2 or 3 years. So I got to go to DC. It really allowed me to understand a bit more the ins and outs in the process of putting forth legislation. So every year, at least once a year, sometimes twice a year, I'd go to DC and visit with our senators and representatives and their aides to discuss specific issues. And each year we might have different issues that we had to deal with. So I had to make sure that I understood the issues. Again, it's not hard to do, but it takes a little bit of time to read through and understand our talking points and then go and share those with our legislators. And then making sure, again, that we're disseminating that information down to the state level as well. So whatever's going on from the federal level, we want to share that across the state so everybody knows what issues we're fighting for. So when it comes to some of the federal issues that we've dealt with over the years, the SGR, the Sustainable Growth Rate. Now, thankfully, we don't hear too much about that anymore because things are starting to change there. But again, the history, and we talked about this in Chapter 31, but the Balanced Budget Act that came about in 1997 was a way for Congress to balance the budget a little bit more, but there was definitely some issues with that. Every year after the Balanced Budget Act was put into effect, there was this mathematical formula that they used to determine how much money they were going to pay out to all healthcare providers based on the services that they provided. And because of this flawed legislation, as the years went on, the change or the decreased amount of reimbursement continued to grow exponentially. A handful of years ago, the cuts were going to be upwards of 25%, and that's a huge cut. And thankfully, though, every year legislators stepped in and put a Band-Aid on these annual cuts, and then kind of rolled it back to what the original rate was, and so that really did help. But we wanted a more long-term fix instead of an annual Band-Aid on that, and so in April 2015, Congress passed the Medicare Access and CHIP Reauthorization Act. This did away with the continual cuts and those kind of Band-Aid fixes that Congress was putting on the BBA, and kind of fixed it once and for all. So that was really, really helpful. But that did cause other problems for PTs. So the next thing that we had was the Medicare therapy cap, and that was one of those things that was put in to try to balance the dollars that were being spent. And so there was a dollar amount that was, and a threshold that was put out for PT, OT, and speech. The way the legislation was written was, and this is really important to understand when it comes to grammar and punctuation, but the way the bill was originally written was there was a dollar amount for OT, PT, and speech therapy. And when you write OT, PT, and speech without a comma between the PT and speech, it combined PT and speech together. So for all these years, while we had this therapy cap, PT and speech had to share the same bucket of money. most of the time, what I do in the outpatient realm, that didn't really affect most of our patients. But if you had somebody that had a need for speech and PT, if you think about some of our patients that have had a stroke and are dealing with that, they're going to dip into, more than likely, their speech and their PT benefits. And so therefore, they were really limited on how much they could have because it was a combined amount. So in 2015, the APTA used that SGR legislation that we just talked about on the last slide as a vehicle. So they attached this Medicare therapy cap thing saying, let's just get rid of it. It's an arbitrary number. It doesn't really make sense. Why are we capping therapy services out, somewhere around $1,300 a year, right around $1,500 a year? Didn't make sense anymore. So in 2015, we were 2 votes shy of the needed votes to pass this. So it didn't pass, unfortunately. And when I was in DC, we were talking to some of the legislators and their aides about this, and one of the aides confided to me that the reason why we didn't get the necessary votes were that the legislators were worried about the election in 2016. And so they didn't want to do anything that might rock the boat because they wanted to make sure they could get elected the following year. And sometimes that becomes frustrating because legislators are always worried about making sure that they get through the next election. So that can be a frustrating process. But in 2016, the legislation was brought forth again, and it did pass. The bad thing here was that it did state that PTAs will receive a decreased reimbursement starting in 2020. So initially, we were happy that we no longer had a therapy cap to deal with in the same way that we did previously, but now all of a sudden they were going to decrease PTA reimbursement. So that is problematic for us, and that continues to be an issue that APTA is and will continue to fight. So how can you help? I think one of the most important thing is become an APTA member and maintain your membership. Right now they have a great student deal where if you're a member as a student and you continue into when you're a practicing clinician for the first handful of years, you get a decreased cost on your APTA membership, which is wonderful. Donating money to your PAC is also really helpful. The money that we pay in as membership dues cannot be used for lobbying efforts. And again, dollars do talk. So we have a PAC from the federal side and a PAC on the state side. And so you can donate money to either one. Some people just donate as little as $10 a month, but any amount helps. And that is, again, what helps us get legislation passed. Joining the P team is another way that you can get all the updates and stay updated on what's going on from both a federal and a state level. And then also, if you get an email from the APTA or from other therapists that are in the community asking you to call or email your legislator, do that. It's really easy to do. It doesn't take much time. It's not a big deal. And honestly, when you call, you're usually talking to an aide or somebody that's answering the phone, so it's not like you're actually going to talk to the legislator, so don't get concerned about, I don't really know what to say. When the email comes out, it'll tell you exactly what to say. It might say, tell Senator so-and-so to vote yes on Senate Bill 231, and here's why. And the person will say, okay, I've noted that, and all they want to do is note how many yeses and how many noes they've gotten for a specific bill, and that helps that representative know or senator know how their constituents want them to vote. So it's really important that we get our voice heard. Usually when you're on the phone too, they're going to ask you for your name and your address because they want to make sure that you're somebody that lives within their district and has voting power to be able to vote them in next time. So those are usually the only questions that are asked. It's pretty straightforward and pretty simple, but it does make a huge difference. PT Licensure Compact. So this is something that you guys are probably somewhat familiar with, but it allows PTs to get privileges to practice in another state that also has a compact agreement. This is a great thing for traveling therapists, great for PTs who might be moving due to military base changes if their spouse or significant other is in the military. And it's a great way to be able to cross state lines and work. So if you think about kind of the Kansas City metro area with Kansas and Missouri, this way you don't have to get licensed in both states. You can get licensed in one and get the compact privilege in the other. So Missouri got compact legislation a couple years back now. They were one of the first states to actually get compact legislation passed. And in 2018, the KPTA, we brought forth legislation as well. Unfortunately, though, that was not passed out of committee. So when you saw that Schoolhouse Rock thing, you can kind of see when it went to the committee, we went to the Senate committee. They asked a lot of questions. Their big concerns were that somebody from out of state might come into our state and end up injuring somebody because they weren't as qualified as clinicians in other states. When it comes to your licensure, and when it comes to having compact privileges, you can't mandate that somebody follow the same rules as they do for licensure. So in Kansas, we do require 40 hours of continuing education every 2 years, and that is the highest across the country. There are a couple other states that require that, but it is the highest level. And the other thing that is required in Kansas that I think is only required in one other state across the country is proof that you have malpractice insurance. So these are the two things that were kind of sticking points for our senators, and therefore they wouldn't even put this bill out of committee and talk about it any further. So that's where we are now. Every state around us right now does have compact privileges except for Kansas. Hopefully someday in the future we can change that and also have compact privileges as well. So that's where we currently are. APTA has put forth an action app, and this is kind of the picture of it from my iPad, so you can kind of see what it looks like. Anybody can get the action app, so it doesn't just have to be members of APTA. So we use this quite a bit when it came to the SGR legislation a couple years ago with our patients. We told them they could download this app. The nice thing about it is you can see all the different buttons they can push. You can, donate to the PAC, but the nice thing is that one at the very top, the Federal Action Center, or in the middle, the State Advocacy. So if you click on the Federal Action Center, it'll bring you to the next page here. And so this is what my current federal page looks like. It shows me who my federal legislators are, as well as my state legislators, and then it talks about specific current issues that are going on right now. If you notice the blue buttons next to any of those current issues, I can go ahead and read more about it if I want to understand what it's actually about, or I can go and specifically take action on that current issue. When you take action, it takes you to the next page that allows you to email from this app immediately why you want to say on that second one, help address the opioid crisis by increasing access to PTs in the National Health Service Corps. So you can look at that, click on that take action button if this is something that's passionate for you, or occasionally I'll just go in there and take action on everything, send an email blast to all of my federal legislators that it specifically interacts with, and it'll automatically send it. It'll also allow you from there to link it up to Facebook and Twitter if you want to do that as well. Sometimes when legislators see that we're tweeting about things and putting their name attached to it as well, they want to be a part of that as well, just like the whole social media thing that's going on right now. So anytime that you can show what's happening, that's really important to let our legislators know that it's important to us one way or the other. So take a moment and look through those. If you haven't downloaded the app, go ahead and do so. It's really handy to have. And like I said, whenever you get an email blast from APTA or the KPTA or whatever state you're practicing in, and it tells you to, they need help and to take action on something, it's really simple just to click that take action button, and then within probably less than 2 minutes, it's done. And especially if you're a member, it'll automatically pull up. So at the top it says welcome Jennifer, so it automatically knows who I am, all of my information, all that good stuff in there, and it just goes straight to my issues. So if you want to learn more about the issues, you can also go to the APTA website. I want you guys to think about what issues you might choose to take action on, and then just do it. Just try it. It's really simple. Like I said, from the website or from the app, there's nothing, you don't have to get on the phone, you don't have to do anything, you just click the buttons and take care of that. But it's a really easy way to stay involved in our profession and continue to make sure that PT is a wonderful profession from here and for many decades to come. So kind of in a recap, make sure that you know the issues. Take action when asked, and you will get an email blast about specific actions that they really want your help on. Get more involved. This is your profession. It is what we make it. So the more involved you get, the more you'll understand the issues, and then you can see what value our association really does provide to us. It really is exciting work, but it takes all of us to step up and help. So if you ever have any questions when it comes to legislative issues or advocacy of any kind, I'm always here to help, even into the future. So please feel free to reach out. That's what we're here for. Thanks for your time.